The only thing I remember is I was getting up to go to the bathroom. I usually get up between 3 and 4 to go to the bathroom. And then I remember hitting my head, and I was like to myself, how did I get on this floor? And then I remember her coming in, and she said, Mom, don't move, don't move, don't move. And that's all I remember from that point.
I heard this loud boom. I didn't know what time it was at the time. And I was just like, is that the neighbors this early? And I just sat in my bed and I said, well, let me go in my mom's room and see if she heard it. And when I walked into her room, I found her face down. And I have to really thank my flight attendant training that I did not panic in that moment. I was scared, especially to see her face all distorted and her left side clearly was in paralysis. So I just grabbed my phone. Her speech was very slurred. She kept saying that she was trying to say that she was okay, but I knew she was not okay. And I said, I think you're having a stroke. Ran, grabbed my phone out of my room, looked at the time. It was 3:33 exactly on the dot. And I called 911.
My first thing when I woke up, I was just looking around trying to figure out why I was there. And he came in. When he came in, he said, you're a very lucky lady. You suffered a very bad stroke. You had a really bad, large clot on the right side of your brain. So I said to myself, wow. So all kind of things were going through my mind. It was like, oh my goodness. Then I said, what about my daughter? And they said, she's okay. We've been in contact with her.
And he came down to the parking lot before I left, and he said, I have great news for you. And he said, I just want you to know that your mother said, the first thing out her mouth when I saw her was, tell Deidre to calm down. And it was just such a relief because I said, that's my mom. Yeah.
Time is of the essence for stroke. It's very important to understand when you have the signs and symptoms. B fast is something that we follow here at Halifax Health. B for balance, E for eyes, F for face, A for arms, S for speech, T, time to call 911. Regionally, Halifax Health is the only center that provides you with a comprehensive level of care for stroke. We can treat you with TPA, we can also do endovascular treatments, and we can do open treatments for hemorrhagic strokes as well. We have a large continuum of physician care. We have neurologists who specialize in stroke care.
My name is Dr. Patrick Hahn. I'm the Medical Director of Neurosurgery here at Halifax Health. I have a specialization in the treatment of patients with stroke, both hemorrhagic stroke and ischemic stroke. We're very excited here as a team to be able to offer full comprehensive treatment, both for ischemic stroke, which is usually caused by a blood vessel that is blocked by clot, using methods such as mechanical thrombectomy or medical treatments such as TPA for breaking up the clot. In addition, we can treat hemorrhagic stroke, which is caused by a rupture of a blood vessel or aneurysm in the brain. And if needed, we can do surgery to evacuate the clot or use minimally invasive techniques to bring a catheter up to the brain through a needle stick incision to perform coil embolization of the aneurysm.
We are a hospital within a hospital. What that means is from the time that you get to the emergency room, we are there for you. The rehab doctor will see you in the acute setting. You're going to start doing some therapies, mobilizing in bed, getting up out of bed, with the goal to get you to the inpatient rehab floor so that you can do more intensive therapy, 18 hours a week.
The staff at Brooks, I can't say nothing but good things about them. I saw them, how they work with other patients, and they seem to be a very dedicated staff. So I recommend Brooks for anybody who has had some type of illness that deserves any type of physical therapy or occupational therapy.
Time is brain.
When it's critical, we are here.